Hi everyone, Dr. Sunil Dand, medical doctor. Welcome to another video. The way that we treat blood pressure is a scandal of epic proportions. And the chances are that you or someone you love is in this circumstance where their blood pressure is being way overtreated. I've talked about this many times before. Of course, I'm not saying that blood pressure medications are never needed, but I believe that millions of people out there are overtreated with regards to their blood pressure. And this tends to get worse with each passing year. And I'm going to share with you in this video a story which was shared with me, which actually makes me think that everything I do is actually worth it in terms of sharing this type of information. So let's summarize the problem then and the extent of the problem and why I think that it is so very dangerous. So the scenario would be something like a 40 or 50-year-old gets put on a blood pressure medication, then another blood pressure medication. Before they know it, they're in their 60s, 70s, and we're dealing with patients who are on 3, 4, sometimes 5 blood pressure medications. It's ridiculous. And a lot of the time, as people get older, they start to need blood pressure medications less. Not all the time, but a lot of the time. And they tend to run at these low blood pressures. The systolic blood pressures might be in the 100s or even 90s, and people will feel very dizzy. They'll feel very weak. They won't be themselves. And then if they get sick, their blood pressure drops even more. So that is something which goes on as an outpatient. And that's why I think everybody should be measuring their own blood pressure at home fairly regularly if they're on blood pressure pills, and make sure that their blood pressure is being appropriately treated and not dropping too much. Again, I'm not saying that everybody who's on blood pressure pills is inappropriately being treated. What I'm saying is millions are. But I'm more concerned as a doctor who works in the hospital with what goes on in the hospital. And I'm going to share with you this story, which is fairly typical. And then I'm going to summarize again the extent of this problem, because I would absolutely hate for this to happen to you or a loved one. And before I even do that, for anyone who may be interested, I have a free copy of my mini e-guide, Metabolic Mastery, which covers many different issues, including insulin resistance, which is linked intrinsically to blood pressure. Link is down below in the description, so do check that out, my free download. Okay, so let me share this story with you, which was a comment under one of my recent videos. Hello, doctor. I really hope you read this comment. I recently had a loved one of a certain age, shall we say, go into hospital for an operation. I had the confidence to ask for the results of all the tests carried out. I noticed that his blood pressure had dropped significantly and mentioned this to a nurse who was just about to give him his prescribed dose of blood pressure medication at the usual time of day after his operation. I asked her politely to inquire if it could lower it too much, as it was already quite low. She looked at me like I was mad, but asked about it anyway and came back and said she was glad I asked, as she was told to skip it for one day for that very reason. This was something I never knew before, but I'd watched in one of your previous videos, and I'm so thankful for your shared informative knowledge. I was able to advocate confidently and informedly on his behalf. Thank you so very much. Please continue to care and share, as you're so very appreciated. Well, on so many levels, receiving stories like that really makes me a little bit emotional, actually, because often when one is making videos, you're obviously most of the time alone in a room, and you wonder whether people are really benefiting from all of your videos and content. But when I hear stories like that, it really makes me feel inside that everything I do is worth it. And I really want to tell anybody out there who may be in a similar circumstance what you should look out for, particularly in a hospital. Now, the first thing to say is that I don't think, with regards to the overtreatment of blood pressure, whether it's as an outpatient or an inpatient, that this is deliberate. I don't think that doctors or even nurses set out to do harm. But this gets to a much, much bigger problem. And this is the attachment that we have in medicine to protocol, to doing whatever we're told from above, especially with regards to doctors following advice from their medical associations and physician societies, which are utterly terrible and really corrupted, and a total lack of common sense and critical thinking. So having said that, let me talk specifically about the hospital scenario and really hammer home the point which you could possibly be in sometime in the future. I mean, this is very common, or a loved one could be facing this circumstance. So when anybody gets sick, especially somebody over the age of 60, typically their blood pressure starts to drop, and they'll show up in the hospital and they might be on 2, 3, 4 blood pressure pills. And a lot of the time, these blood pressure pills are simply continued. They are ticked off without due regard for the fact that the person is sick and they might be running at a low blood pressure. So many times people in the hospital will receive all of these blood pressure medications at 8 a.m. or 9 a.m. when their blood pressure is already low. And I speak as somebody who's worked in so many different hospitals up and down the East Coast of the United States. I'm very familiar with protocols. And a lot of times, doctors will write, because it's reflex and it's just the way things are done, here's a blood pressure pill. Hold it if the blood pressure is less than 100. This is the top number, the systolic number. Hold if less than 100, or if we're dealing with a blood pressure medication like a beta blocker, which also affects the pulse, hold if less than, say, a pulse of 60. But here is what so commonly happens. So somebody is running at a blood pressure 102, 103, and because the parameter says that, the nurse will go ahead and administer 2 or 3 blood pressure pills. So think about this, and it doesn't take Einstein to work this out. Somebody's already running at a low blood pressure, and then you give 2 or 3 blood pressure pills, and half an hour later, 1 hour later, their systolic blood pressure, the top number, will be in the 90s or it will be in the 80s. And it's well known. Ask nurses out there. Nurses are the best people to talk to who notice patterns. There are a lot of very seasoned nurses who will say the times when our patients have a rapid response, that's when there's a semi-emergent situation, like a patient will start to become less conscious or their blood pressure might tank. A rapid response is called, and then all the doctors will rush to the bedside. The time for a rapid response is most commonly half an hour after we do our med pass. Okay, that's a very commonly known thing among nurses. So why does this happen? And again, I don't think it's malice on the side of doctors or nurses. It's simply a mindless protocol following. What I do as a doctor is I set the parameter much higher. When I'm admitting a patient or taking care of them, I will say, do not administer blood pressure medications if the systolic blood pressure is less than 110 or even 120. Don't even think of giving additional blood pressure medications. Sometimes they will need something, even if it's in the 110s, because their body is used to it. But frequently, actually, I cut way back on their blood pressure pills. So I think the best thing to do in this circumstance, now my whole motto is be your own best doctor, be the best advocate for yourself and a loved one. And also think outside the box. Don't assume anything. So like this person did in this story that I shared, what I would like you to do if you or a loved one is ever admitted to hospital and blood pressure is an issue, ask for the vital signs every day. I mean, nowadays you can look at this information on my chart. And it might seem strange to say that, but I really think you should. Your health and well-being and your loved one's health is simply too important. And make sure that the medical team is not loading people up who are sick and running at a low blood pressure on more blood pressure pills. Really bad things can happen. Blood pressure can tank. People can become less conscious. People can get up. People can fall. And it's such a massive scandal, which is fairly universal across hospitals. Doctors and the medical establishment are stuck in a mindset of medicines, good. Medicines, good. And there's just a total lack of common sense. And you have to take it in your own hands, like other things, like making sure your loved one gets up and starts moving and doesn't get sinking in bed syndrome and deconditioned. I've talked about that recently as well. So that is the take-home message, okay? Points to remember. Number 1, we have a scandal of epic proportions. Blood pressure is overtreated both as an outpatient and an inpatient. Number 2, this problem gets worse as somebody gets older. Number 3, I'm not saying blood pressure medications are never needed, but number 4, I am saying that when somebody's sick, frequently you taper down on the blood pressure medications, and a lot of times, even when somebody's at home, especially if somebody's in their late 60s, 70s, and 80s, they start to need less blood pressure pills. So it is on you to advocate for yourself and your loved one. This is about you being as healthy as possible. That's my only goal. I want as many people as possible to stay healthy naturally, to avoid interactions with the medical industrial complex, and ideally stay away from pills and injections. That should be a last resort. I speak from the heart. My only intention is your best health. I'm rooting for you and your loved one to succeed in a very suboptimal environment. Okay, everyone, thank you for watching. I do hope that was helpful. Once again, do check out my Metabolic Mastery free guide mini ebook. That is down below. Also, leave a comment down below if you've experienced anything of what I've just been talking about. Do share your story, or if any of my other videos have helped you, share that story as well down below. I really enjoy reading your comments. Okay, also check the links in the description down below for my website, all the other work I do, and our natural supplement store, ohighwellness.com. If you're in the USA, North America, ohighwellness.co. If you're in the UK, Europe, we are very proud to be expanding our range of natural, high-quality organic supplements. Hit the like button if you like this video, the subscribe button for more similar videos in the future. That really helps with the algorithm and getting these videos shared as widely as possible. And if you enjoyed this video, you will also enjoy some of my other videos on how to have the best possible metabolic health naturally. We will speak again very soon.